Mr. Speaker, for over 30 years, I wore a pink tie like the one I have on today to work most every day. As you know, October is Breast Cancer Awareness Month. But what most people don't realize is that 1 out of 8 women develop breast cancer in their life. And as an obstetrician and gynecologist, I've had to tell hundreds of women that very bad news. And that's why I try to remember every October, remember to encourage women to go get their mammogram done. If you're over the age of 35 and it's been over a year since your last mammogram, please call your physician's office, talk to a nurse and ask her, is it time for you to go get your next mammogram done? I think it's good for us to talk about risk factors for breast cancer. And of course, everyone knows about the risk of a family member having breast cancer increases your risk. And that may encourage you to get your mammogram done more often and at a younger age. And if you have more than one first-degree relative with breast cancer, you'll want to talk to your doctor about some genetic studies to see if indeed you're carrying some type of a gene mutation that would increase your risk for breast cancer. But there's other risk factors as well that people don't often think about. A poor diet that's high in fat increases your risk of breast cancer. Obesity increases your risk of breast cancer. Lack of exercise increases your risk of breast cancer. Smoking increases your risk of breast cancer. History of radiation exposure to the chest increases your risk of breast cancer. So a good diet, regular exercise, 30 minutes of walking every day will decrease your risk. What people often ask me about, though, are the ways also that you can prevent breast cancer or decrease your risk. I've already mentioned that a good diet and exercise, but breastfeeding also protects you, decreases your risk from breast cancer. One more reason why women should consider breastfeeding when they have their baby. But what I want to emphasize today is that most new people diagnosed with breast cancer have no risk factors. Let me say that again. Most women that diagnosed with breast cancer have no risk factor at all. And that's why it's important to get your mammogram done on a regular basis. The mammogram can pick up breast cancer 2 or 3 years before you can feel something, making the cancer much more treatable. And with that, Mr. Speaker, I wanted to say thank you and yield back.